Lots of people want facial rejuvenation. They want their face to look better. They want their neck tighter. They want their jawline tighter. But I'm going to talk about what it takes to get a natural result and how, as a doctor and a patient, we can avoid an unnatural operated appearance. Hi, I'm Dr. Jonathan Sykes. I'm here in Beverly Hills, and I'm going to talk about natural appearance in facelifts. Let's look at some results to see what natural appearance after facelifts are. In the first patient, this is a middle 60s woman who's Caucasian. She has a beautiful face, beautiful eyes. She's made a decision to do nothing to her eyelids, and what we did to her was to lift her mid-face, to lift her neck and tighten it, and to take some autologous or her own fat and inject that a little bit into her lips, a little bit into her wrinkles, because she had some volume loss and a little bit of acne scarring. If you look at the after picture, she looks natural. She looks like a better self, a rejuvenated self, a person that might have had a vacation, not somebody who really looks like they've had an operation. In fact, none of her friends know that she's had any work done on her face, and that's what you want. That's really what you want when you want to have a facelift. If you look at her from the side, she has a much more angular angle between her chin, her jawline, and her neck. This is what our eye wants to see. So she's had a facelift and fat augmentation. Most of my patients want to look natural. They want to look younger. They want to look like themselves, and they're afraid to look unnatural. They talk out of both sides of their mouth. On one side of their mouth, they want to say, I want to look better. I want the wrinkles gone. I want my neck tighter. I want my jawline tighter. Out of the other side of their mouth, they say, I want to look like myself. I don't want to look different. They're going to look different, but they have to look like they haven't had surgery. So how do we get to that? What really makes an unnatural result in facelifting? A couple of things. When a doctor tries to do too much, and when the vector of pull in the facelift is unnatural, and this is what I mean by that. In our neck, we want a pull that makes the neck look angular, so that there's a nice angle between the jawline and the neckline. And in the face, we want a more vertical pull. If we have a more horizontal pull in the face, we pull the corner of the mouth. It's a swept look, and that person looks unnatural. And as an observer, we don't always know exactly what we're looking at, but we know it doesn't look right. We know it looks like it's had an operation, and this is totally avoidable. Now, in a facelift, we make some incisions that are around the ear, and these should be hidden, not change the hairline in the temple, not change the hairline behind the ear, and everything down here should look natural, not too pulled. In the second patient, we see a patient who's had a few procedures. The first was upper and lower eyelid surgery, some fat grafting to her midface, a facelift, which included the midface, the neck, and lastly, a lip lift. I've done her lip lift with a small incision at the base of her nose, and what that does is it shortens her white lip and everts her red lip. It everts her red lip and makes it look like her red lip, or the pink part of her lip, is fuller. And that shorter white lip and everted fuller red lip is what we have when we're young. So she doesn't look like a 22-year-old woman, but she looks like a better version of herself. In fact, she probably looks like a daughter. It's probably set her back 15 or 20 years. When you look at her from the side, and from the oblique area, from the oblique shot, she has an angular jawline. She has a good tightening of her neck. She has elevation of her cheek fat, and she just looks better. Her lip is a little everted, and that makes her look much, much better. She's really pleased with this. And again, none of her friends know that I've touched her. I always like to say, I want your face to look better. If you decide to tell your friends that I operated on you, I'm really happy, but I don't want your face to tell them. If you notice in patient number 2, from both the front and the side, I've done a number of procedures. I did her upper eyelids, I did her lower eyelids, I did a cheek lift, jowl lift, neck lift, I did fat grafting, and I did a lip lift. A lot of people think a lot of procedures will make you look unnatural. Quite the contrary. I didn't overdo any of these individual procedures, and the composite is a very natural look. When you add them all together, little changes of a lot of different procedures don't make her look not like herself. She looks very much like herself. She looks very natural. She just looks rejuvenated. So the whole idea that a lot of procedures make you look unnatural is not true. If you look at her from the side, her hairline is not moved, her earlobes look natural, her jawline looks natural, and everything around her mouth looks natural. Had I tried to achieve this all with 1 or 2 procedures, not done her eyelids, overdone her facelift, she would get a pulled look. Had I tried to pull out all of her wrinkles with just the facelift procedure, I don't think we would have had the same effect. The general idea that a lot of procedures create an unnatural operated appearance is not true. You can overdo one procedure and make it look operated upon. However, you can do a lot of procedures and make the result look very natural. That's what I want to try to achieve. That's really what I want to do. So if you can do that, if you can achieve this, this surgery is wonderful, and my patients are generally ecstatic with the results. In the third patient, this woman's in her 70s, and she's had upper and lower eyelid surgery, a facelift, and fat augmentation. I've done nothing to her lips. She has great volume to her face. She's got great cheek fat pads, and I've lifted up her cheeks, and that lifted cheek area makes her face look better. She's got a more angular jawline. It's taken her face from relatively bottom heavy to relatively top heavy. We like this for the face. We don't like this as much. When we have jowls, we don't like that. So I've lifted these up, lifted this up, and that makes her look more natural. If you look at her from the side, she looks much better, but she looks like herself. There's no distortion of the hairline. There's no distortion of the earlobe. There ought to be no tension on the wounds so that the earlobe is not distorted, and the incisions ought to be almost indiscernible. An important concept with facelifting and with rejuvenation in general is to not to try to do too much with one procedure. Sometimes a physician will try to pull so hard as to pull out all the wrinkles below. That's not a good idea. What I try to do is do some lifting and some volumization. That usually involves adding a little bit of filler or fat augmentation at the same time that the facelift is performed. This is a really important thing. If the surgeon tries to do too much with one procedure, that will lead to an unnatural result. At the end of a facelift, we want a result that makes the patient look like themselves, but rejuvenated, but better, a better one of themselves. That's so important. What we don't want to do is change the hairline, have noticeable scars, change the earlobe. We want the earlobe to remain, and change the posterior hairline. All these things we want to remain as they were. These are just access points to do what we want down here, to make the central face rejuvenated. In the fourth patient, you'll see another patient who has had a marvelous face rejuvenation. She's in her late 50s, although she doesn't look it. She has a thin face. I've chosen to do a facelift, which is her mid-face, her neck. I've done some fat grafting to her mid-face and a little bit to her lips. I've done a lip lift, and then I did a chemical peel to her skin around her mouth. That's improved her wrinkles. I didn't try to pull the wrinkles entirely out. I just tried to lift enough so that all the other ancillary procedures, the additive procedures, looked great. She has an angled look to her neck. She has a nice angular jawline, and her fat in her face has been lifted up so that the shape of her face is heart-shaped. And that we like. There are patients that come into my office that only want their lower face done or only want their upper face done. And that's certainly a choice for every one of my patients. That's part of my discussion with them. If a patient just wants to improve their lower face, I try to find out what they want to improve. Do they want to improve their mouth, the lines, the lip relationship, the chin? Sometimes it involves putting augmentation, making the skeleton stronger with either injections or a chin implant, improving the jawline. Sometimes it's tightening the skin, doing a facelift, a neck or facelift. Sometimes it's adding volume with fat grafting. Sometimes it's doing a lip lift. It can be any of those. And lastly, sort of the icing on the cake might be making the skin quality the best. That might be a chemical peel or laser resurfacing. That might be make the skin cover. Facelifts make the underneath good. Resurfacing, which could be laser resurfacing or a chemical peel, make the surface better. I look at each patient and decide what they need and match that to what they want. They have wants, I have what I do. I try to meld those together. That's what we want to achieve. So in summary, I would say that facelifting is something that can achieve natural results that don't have to look operated upon. You don't have to look like you've had an operation. A lot of people have shied away from facelifts because they see a person in a restaurant or at the mall that looks like they've had surgery. They don't know what the person's had, but they think they've had a bad facelift. They've had an unnatural facelift. You don't need to have this. This is not what I do. You can get a result with facelifting that makes you look like you've had no surgery. And this is what we really want to achieve. A natural result from a facelift starts with a complete consultation. And that process should not be circumvented. You've got to be very careful with the consultation, both the patient and the physician. From the physician, they ought to ask the patient what they want to achieve. Then they ought to carefully examine the patient, look at their skin texture, look at their fat content, look at their bone structure, and make a determination what they're going to achieve with this lift. And lastly, a careful discussion ought to go on where the doctor tells the patient what they're going to get, what the range of results are, how the healing is going to be, how long it's going to take, how much the downtime is going to be, and discuss all the healing processes. I never like to shortcut the consultation. A lot of people say, I want to sign up for a facelift. They call me on the phone, I want to see you, I want to examine you, I want to listen to what you want to achieve, and then I want to match that to what I do. I'd love to see you for a consultation. I think that's the start to this. And a good consultation is what it takes to make this work. I was the director of facial plastic and reconstructive surgery at the University of California, Davis Medical Center in Sacramento for over 25 years. I'm the past president of the American Academy of Facial Plastic Surgery. I've authored more than 200 chapters, articles, and several textbooks on facial plastic surgery. I've done a lot of operations. My career has led me to experience that knows what a good result is and what an unnatural result is. If an individual wants to get in touch with me and schedule a consultation, and of course, a consultation is the start of this process. It is the start of the process. We have to do a complete consultation, and we shouldn't shortcut that process. If you want to do that, contact my Beverly Hills office. You could do that by looking on our website. You could call us on the phone. You could email us. I have a wonderful coordinator, Maria, who will call you back immediately and will listen to your needs and set up a consultation, a personal consultation with you and me. That's the start of this. I look forward to seeing you.